Good evening, everybody. Thank you for joining us this evening. There are three intersecting strands which bring tonight together. One is the fact that it's Holocaust Memorial Day this week, which, as everybody here sure knows, is chosen as a date that commemorates the capture and exposure of the Auschwitz concentration camp in 1945. The second issue is that related to that, one of the people who's present tonight is Shmuel Rice, who was the only time we actually had a previous formal Jewish Medical Association Holocaust Memorial Day event. Shmuel Rice was the speaker, and he was the person who played a major role in the setting up of what is the Lancet Medicine and Holocaust Initiative, which was launched in November 2023. In addition, of course, we're also taking on Holocaust Memorial Day this year a different vantage point, the vantage point of the events of October the 7th, 2023, and its subsequent, what has happened and is what's ongoing and happening at present in Israel and in the surrounding areas. These three come together, and but when I was posed with the question of what we were actually going to do about this, I had been participating in some discussions with Israelis and with others from around the world about the reaction to October the 7th. And one of the people present in these discussions was a young lady by the name of Shani Levani. And Shani studied medicine and has just completed her studies, is about to begin her internship at the Ben Gurion University Medical School. She played a leading role as a medical student there, and she also has played a leading role in the Lancet Medicine and Holocaust Initiative. And she's been the person who represented really students in general, as well as herself, and as well as the Israeli medical students. And she seemed to be an obvious person to bring these together. And if I may say so, she seemed to be an obvious person to bring these together because her contributions to this discussion were so succinct, insightful, and appropriate, which often, as you know, all of us know in this gathering, often doesn't happen when you've got meetings amongst Jews. Now, we also have present tonight, and we're very pleased to have present with us, some other people. Professor Philip Banfield, chairman of the BMA Council, is attending, along with Ashleen Benjamin, who's worked with the Jewish community on the Racism and Anti-Semitism Declaration from the BNA, and other staff members of that council. So we have together everybody here obviously is a distinguished audience, and many of you are loyal followers and participants in Jewish Medical Association UK events, but we particularly wanted to mention those. And we also thought that it would be appropriate to comment that the family of Shani have chosen to come to this particular talk as opposed to others, which I know that she has done or is doing in other parts of the world, and we're very delighted to have them with us. So I'll hand you over to Shani. I've spoken for far too long because it's her that you need to listen to, not to me.
Thank you, David, for this introduction. As David said, my name is Shani Levani. I just finished medical school this past summer and will start my internship soon. I'm also at the final stages of receiving my master's degree in public health. And I was invited to speak today for the marking of the International Holocaust Memorial Day, which is in 3 days. And For those who hasn't read the flyer thoroughly or joined in late, and are wondering what qualifies me to give this talk tonight. So for 5 years now, I've been the TA / co-director of the course Medicine's Reflection in the Holocaust in the medical school I went to, the Goldman Medical School in Ben-Gurion University of the Negev in Beersheba. And I am also the assistant to the Lancet Commission on Medicine, Nazism, and the Holocaust, and the head of the Student Advisory Council of the Commission. But there's one reason above all that makes this topic so important to me personally, and is that my grandmother Leah, her twin sister Judith, and their mother Rosie were all subjects of medical experiments in Auschwitz. And as far as I see it, medicine and the Holocaust is my family's story. It's my legacy. And learning it, teaching it are my ways to have a closure and to maybe help heal some of the wounds my family carries. So we will talk today about a few things, but this won't be a lecture about the history of medicine, Nazism, and the Holocaust itself. And my main goal today is to try and convince you it is important to learn it, regardless of your training level, discipline, religion, nationality, or personal connection to the Holocaust. Yeah. So the most often asked question I get from medical students taking my course and medical professionals I give introduction lectures to is, what history got to do with medicine? And I usually answer back with a couple of questions. So why is medical history an important part of anamnesis taking? And the second one, how does it affect the patient's care? And the answers, I hope, are clear to you. Medical history is important because it has a huge treatment changing and even life-changing effects on the patient. And if I'll think of the medical profession as a patient, if I want to improve the health of the profession, shouldn't we know its history? What went wrong in the past? What are the conditions we are treating? And when I say treating the profession, the health of the profession, I mean it in the broadest sense possible. Profession is not just the registered practicing physicians treating patients directly. It's the medical education student, residents, and even certified expert receive. It's the local and global health system. It's the policy, the way it is being made and how it is implemented. It's the relations between our discipline and politics, domestically, globally, and so on and so on. So as far as I see it, if we want to improve any aspect of our profession, of course, everyone in their own scope and ability, we need to know the history of it because it affects the treatment we need to give. So what's history got to do with medicine? Well, everything. And now let's assume my a bit simplified analogy managed to convince you to convince you knowing the history of our profession is important. Why learn about medicine, Nazism, and the Holocaust and not other historically relevant events? What makes this history more relevant? And I'd like to answer that with another analogy. So let's say I'm a GP, and on a certain day, I see two patients in my clinic. The first is a young male, usually healthy, no chronic diseases, not using any kind of medication, doesn't have any significant medical conditions in his family, a non-smoker, and he complains of high fever for the last 3 days, cough, and some breathing discomfort, which were preceded by a week of rhinorrhea. On my examination, I hear crackles with decreased breathing sounds, matching in location to the right lower lobe. And I diagnose him with pneumonia and prescribe antibiotics for a week. Now I want to ask you, rhetorically, obviously, how long will this kind of appointment be? 10 minutes from the moment he steps in to the moment he leaves? Maybe less if it's a patient I already know and I'm familiar with his medical history. And what role or effect his medical history had on the way I cared for him? Well, probably not much. It helped me to rule out some more serious differential diagnosis. It helped me decide on the appropriate treatment, because I will not give amoxicillin to a patient who had a penicillin allergic reaction in the past. So it helped me to choose the appropriate treatment, but generally it made me understand that the hoofbeats I'm hearing are really horses and there's no need to consider zebras. And now the other patient I see is a 60 years old lady. She has been diagnosed with lupus for 30 years now, had many exacerbations over the years, was treated with oral steroids many times, to the point she developed diabetes at 45 years old. Her disease had many manifestations over the years, like ACLA with PE and CVAs, joint involvement, alopecia, distinctive rashes, spondylitis, ocular disturbances, and so on. And she went through multiple treatment lines over the years, and in the last year, she hasn't been symptoms-free, and her condition wasn't controlled. And she also complains of 3 days of high fever, cough, and some breathing discomfort, which were preceded by a week of rhinorrhea. On my examination, I hear crackles with decreased breathing sounds matching in location to the right lower lobe. So what will my diagnosis be now? Will I be as quick as I was with the first patient to diagnose her with simple pneumonia? Will I refer her to ancillary tests like blood tests and chest X-ray? How long will the appointment take? Will it also be 10 minutes from start to finish? How much longer will it be if it's her first time in my clinic and I need to take all of that medical history from the beginning? So what role or effect her medical history have on the way I need to care for her? Well, a pretty extensive effect. It makes some very serious yet usually not probable differential diagnosis a real possibility. Can it be acute lupus pneumonitis? Maybe she has pleural effusion. Maybe it is pneumonia, but because of her medications, she is immunocompromised, and it is not a common pathogen causing this pneumonia. Her medical history dramatically affects the way I need to care for her and manage her symptoms and sickness. Every bit of her medical history changes and shapes the management and the diagnostical possibilities of her condition, of her current condition. And we all know how lupus can affect almost any system or organ in the body. It makes the hoofbeats I'm hearing more likely to be zebras or even unicorns than horses. So what these two patients have to do with reasons to learn the history of medicine, Nazism, and the Holocaust. If previously I said the patient's history affects the treatment, it's important to know. And the medical profession is analogous to a patient in a way. Now I'm adding to that, and I want to claim that different medical histories have different effects on the patient's management and on how we are informed by them. Some histories have an acute effect, some have chronic effect, some have narrow effects, some have wide, some rule out differential diagnoses, and some rule them in. So in the same way, some of the histories of the medical profession inform the way we practice medicine more extensively than others. And now, I wouldn't be so audacious to claim that the history of medicine, Nazism, and the Holocaust has more significant effects on our practice than other histories of the profession. Or, well, I wouldn't claim that without some evidence. So as I introduced myself in the beginning, I've been the head of the Student Advisory Council to the Lancet Commission on Medicine, Nazism, and the Holocaust for the approximately last 3 years. And the Student Advisory Council, the SAC, was assembled with the notion of adding diverse and, well, young perspective to the commission. The SAC members are from various healthcare professions such as medicine, nursing, bioethics, public health, and neurosciences. And we have members representing a wide range of countries: Austria, Canada, Cyprus, Germany, Greece, India, Indonesia, Israel, Japan, Kenya, Spain, and the US. And over the course of our collaboration, we met once a month to expand our knowledge, to discuss questions asked by the commissioners, to discuss our perspectives and opinions on the commission's work, to work on creating a wider understanding of the relevance of medicine, Nazism, and the Holocaust education in different regions of the world, and to help each other develop local educational programs. And when I reflect on this experience, what I find as the most unique part of it is the realization of how something that is very personal to me can also speak to others with non-inferior impact. And when I started to work with the SIC, I was already teaching medicine, Nazism, and the Holocaust in my medical school. And it wasn't a unique experience when my students had a personal connection or interest in this history. And they were mostly Jewish. Some of them were third generation to survivors. could obviously understand it. And it was not improbable for them to know that they may treat survivors at one point or another. And moreover, in Israel, there's a certain ethos to the Holocaust. It's almost like a living entity. Almost everyone learns it in school, learns about it in school. There's the 2 minutes commemoration siren every Hebrew Holocaust Memorial Day. And it's a sort of a shared social sensitivity. But once I reflected on my surprise, why I was surprised to discover that non-Jewish, non-Israelis can relate to this topic with this much of intensity, I understood that I wasn't supposed to be surprised. I was already teaching my students mostly very universal lessons. None of the main morals I tried to teach them required them to be descendant of survivors or Israelis or Jewish. The only requirement was for them to be part of the healthcare community. And well, another requirement is for them to be interested in forming a professional identity that is beneficial for their future patients. So on November 9, 2023, less than 3 months ago, the Commission launched its report. And together with the SAC, I had the honor of publishing a comment in the Lancet about the Commission's report. And while the report calls for the teaching of medicine, Nazism, and the Holocaust, in our comment, we chose to focus on why to learn it. And there are a few points we made to support the call to learn it. And the first is, as I said, the universal lessons of it, the core ethical transgressions and morals to learn from this history are relevant regardless of nationality, religion, race, ethnicity, or gender. It is no secret that ethics courses are not students' favorite, and medicine and Holocaust studies reframe ethics in a more real way. It's a less theoretical and more practical study of ethics. One of the ways it reframes it is by compelling the learner to focus on decision making rather than on specific details of the moral dilemmas, because the specifics are so extreme in dilemmas from the history of medicine, Nazism, and the Holocaust, and it's quite obvious to the learner that they won't encounter the exact same situation. So there's no need for them to memorize the details of the situation, and it leaves room to learn from the process of decision making. And another way it reframes the study of ethics, it's the understanding of the ability to cause harm. And it's an understanding that as a physician, we understand that our ability to cause harm, and we understand our power over our patients in a rather late stage of our studies or training or whatever. And as a rule, I think it's safe to say that most practitioners study medicine with the notion they will help others, and no one become a physician or comes to this profession with a desire to harm. But harm is part of nature of power dynamics, and only when we acknowledge our ability to cause harm, we can try to prevent it. And this history provides ample examples of the abuse of power with the notion of I'm doing good while I'm actually doing evil. And the complexity and longitudinal prevailing nature of the Nazi crimes and other medical crimes of the time cannot be dealt with without profound critical thinking. The rhetoric of the Nazis and that era in medicine in general is so distorted while also subtle that if you don't approach it with criticism, you will be left confused and torn. And with all the bad that one can learn from this history, there's also good. There are courageous physicians who stood up for their patients and resisted and were true to the purpose of the profession, and they teach us of our moral duties. They show us what we need to do and not just what we don't need to do. And there are more reasons to learn medicine, Nazism, and the Holocaust, and they are described in the SAC's comment to the report, and they are discussed in the report itself. And I encourage you to read it. But moving on, so far I gave you some position-friendly analogies, and I told you about the SAC and what we did. But this lecture is called Echoes and Reflections, and I did very little of that. So now I'd like to make my personal case using my own echoes and reflections for why I think personally it's important to learn this history. But first, I think I need to explain what echoes and reflections mean and why it's so relevant to the learning of medicine, Nazism, and the Holocaust. So beside the poetic ring of this these two words together, there's the obvious by name association to the Roman story or mythology of Echo and Narcissus. So the nymph Echo falls in love with Narcissus, but can't speak with him because he was cursed and can only repeat the last words of what others say. And when they meet at last, he rejects her because he is disgusted with her weird trade of only repeating him. Then another goddess punishes him, curses him to fall in love with an unreciprocating love object. This leads him to fall in love with his own reflection in the pond, reflection he does not recognize as his own. And what happens next is that they basically both waste away and eventually die. He while looking at his reflection and she while echoing the words of love he is saying to his own reflection. So when I say echoes and reflections in relation to learning the history of medicine, Nazism, and the Holocaust, I speak of for me, some certain stop signs calling for my attention. And echoes is my metaphor for the resemblance between past and current events. And just like actual echoes, they are not exactly like the origin. And I strive to be nothing like Narcissus, and I'd like to be able to recognize these echoes as echoes. That means I don't expect to encounter situations identical to events during the times of Nazism and the Holocaust, but I can encounter situations that will remind me of that history and can inform my actions while distinguishing the differences. And reflections is my metaphor for the ability to see ourselves clearly, bad and good, to be critical of what we see. And of course, there's the educational tool that is very relevant to this, to the education of medicine, Nazism, and the Holocaust, which is the reflective writing, using reflections as a educational tool. So more on the metaphor of reflections. The reflection we see depends on the mirror and the lens we use. So we must always scrutinize the mirror and the lens we use. Is it a distorting kind of mirror? Maybe I wear pink lenses, making everything look peaches? So that's what echoes and reflections mean to me. And for the sake of providing you with current and relevant context, I'm going to speak about the pink elephant in the room, which is the October 7th pogrom. And I'm gonna stop share for a while so I can see you, but you will see me in a bigger way, bigger screen. So because October 7th was a holiday and Shabbat, I was staying at my parents' house, which is about almost a 2 hours drive from the hospital I'm working, the Soroka University Medical Center in Beersheba, which is the largest hospital in southern Israel. And on that day, I woke up at 6:29 a.m. To the sound of the rocket alarm. And we all ran to the safe room and stayed there for a bit. And then I must say I went back to sleep because rockets being fired on civilian population in Israel it's a matter of fact, sadly. And a couple of hours later, my mother wakes me up and says, well, Shani, something big is happening in southern Israel. I think you need to go help in Soroka. And not long after, I was racing myself, or actually racing my car, while rockets are flying above me. I was racing to Soroka, knowing that most of the injured will be brought there. And I parked my car outside the hospital because I had a feeling that even though it was Shabbat, I would not be able to find a parking spot inside the hospital. And the moment I walked in, I discovered how little did I understand of what was really going on. I've been studying and working in that hospital for 6 years, and I have never before seen the outer skirt of the hospital and all of the parking lots as packed as they were that day. There were cars parked on the sidewalks, and on the lawns, and there was no place to feed even a bicycle between the cars, so let alone another car. And some of the cars had bullet holes in them, shattered windows, and even blood stains. And I quickly changed to scrubs and went straight to the emergency room. And when I walked into the ER, I was hit by the ghastly smell of fire and smoke, burnt flesh, and blood. And that was the first time in many to come that the word Holocaust popped in my head. The smell reminded me of how Holocaust survivors have described the smell of the crematoria in Auschwitz and other death camps. And up to that moment, the echoes of the Holocaust weren't apparent to me. I understood it was not an ordinary terror attack, that it was something in a scale we haven't seen yet in Israel, but no Holocaust echoes until that moment. And I think we all know that it is not ordinary for Jewish people, let alone direct descendants of survivors, to call something, anything, no matter how bad it is, a Holocaust. And moreover, I avoid at all costs using what is called the Nazi card or the Holocaust card, or even just to make simple comparisons to the Holocaust, out of respect to the gravity of the Holocaust. So when I say that the word Holocaust surfaced in my mind, I do not say it lightly. I say it with humble intentions and with awe and reverence to the magnitude of this word. And this is why I refer to it as an echo and not an actual Holocaust. So the word Holocaust that kept surfacing in my mind, and the echoes I felt were calling to me, made me aware of how this history was influencing me in the present in that very ER. And going back to the ER, there were so many injured that the hallways were blocked, and passing with a gurney was nearly impossible. There were people screaming in pain and crying from agony and wandering around lost and despair, looking relentlessly for their loved ones. And I was very aware of what I was doing at every moment, because I knew from all the reflections I've been doing over the years that in such an emergency, I want to have a choice in how I act, and to not just follow algorithms. We are trained to follow flow charts and action scams, and especially in emergencies, events, mass casualties, and so on. And with a justified reason, this is how the most lives are saved. And this is how you don't freeze in this chaos, but act. But no mass casualty action plan take into account the in-between moments, the non-patients, non-personal people who are in your ER looking for their loved ones. And when you move from one patient to the next, and on your way, a crying mother asks you if you have seen her son, there's no algorithm for that. When a patient refuses to be taken to surgery because he lost his girlfriend in the rave, and thinks she's injured, and he must know what happened to her, no algorithm prepares you for that. And in these moments, this kind of moments, I wanted to be aware of the choices I was making, I made, so I would be able to reflect on that day and be proud the choices I made. And I immediately started to do the forgotten tasks. For example, when I drew blood from a young female soldier covered in ashes, wearing uniform pants, but PJ's top, I asked if she spoke with her parents yet. And she said no, because she lost her cell phone. And I gave her my cell phone to use while I finished taking blood from her. And she was there for 2 hours already and did not call to any of her parents because she had no cell phone. And when I heard the young man in the bed next to the patient I was later treating, saying he won't go to surgery until he finds his girlfriend, I told him to write down for me her name and his cell number, and send me a picture of her. And I promised him I will look for her while he is in surgery and I move between patients and wards. And just like I promised him, every time I moved to the next patient or the next task or between the wards or between surgery rooms or whatever I'd done that day, I kept my eyes peeled and looked for her. And when others noticed that what I was doing, they asked me to look for their loved ones as well. And at the end of that day, I still have it actually. I had a list of names and a bunch of photos of strangers on my phone. This list wasn't much of a help, of a use, because I only found one person, the first girl on the list, the one who started it all. And for her and for her boyfriend, I hope it made a difference. And another encounter in which I had a choice to make was when a baby needed someone to be with him until his aunt came to be with him because both of his parents were murdered. And I decided I won't just watch him lay in his crib. I picked him up and I cuddled him and sang to him and soothed him. I'm not sure if my singing was soothing him, but I tried. And when his aunt came, she could at least know that we treated more than just his dehydration. We cared for his emotional needs as well. And this is just a few of the choices I did that day, and few examples of the choices all of the medical personnel who were there that they had to deal with. And through learning about medicine and the Holocaust and reflecting on it, I was much better prepared, even in the middle of a mass casualty event, because I had learned and thought of resource allocation, of showing compassion, of triage and prioritizing, of getting informed consent, of medical confidentiality, of primum non carne. I've been thinking about this practically every day in the last 5 years. So in that day, I was putting into practice all the ethical and professional algorithms I was developing for myself. These ethical algorithms, what I call ethical algorithms, are just a set of questions I ask myself while practicing, get a better understanding of the ethical or moral aspects of the situation I'm encountering in the moment, to guide my choice, and that my choices were informed by the recognition of the relevance of these echoes I recognized, and I navigated the choices by the ethical algorithms I developed for myself through reflecting on the history of medicine, Nazism, and the Holocaust. And basically, in a nutshell, that was my October 7th doings. So why learn about medicine, Nazism, and the Holocaust? So the history of the profession as a patient matters. The history of our profession is lupus and not pneumonia in a healthy young man. The lessons of this history are universal. They reframes ethic studies. They inform our ability. They inform of our ability to cause harm. They promote critical thinking and highlights moral duties. And it helps with recognition of the echoes of this history, which informs choices, and reflecting upon this history helps navigate difficult decisions. So I would like, I would like to finish with a video of my favorite women in the world, my grandmother and her twin. I'm showing it at the end of my lecture because they sum up everything I just said over the last 40 minutes in 5 minutes, and they do it way better than me. This film that we're going to see was filmed just a few days before October 7th for the launch of the report by the Lancet Commission on Medicine, Nazism, and the Holocaust. And it's in Hebrew, but there are subtitles, and it is an important video. So for me, so that's why I'm playing it, even though it's in Hebrew. Sorry.
אנחנו נולדנו ב-1937 בשמלאו סילבני, הונגריה, וב-1944 נכנסו הנאצים להונגריה, ואחרי לא תקופה ארוכה לקחו אותנו לגטו, שם היינו 4 שבועות. בתנאים מאוד קשים. מאוד קשים, בלי תנאים אנושיים. ומשם לקחו אותנו לקרונות, קרונות של בהמות, בלי אוכל, בלי מים, בלי תנאים. בלי שירותים. בלי שירותים, בלי שום דבר. אחרי 5 ימים הגענו לאושוויץ, הרכבת נעצרה. הורידו אותנו עד 2 מהקרונות, ופתאום אנחנו ראינו בחוץ אנשים לבושים עם בגדים עם פסים. אנחנו ירדנו למטה, בתוך שנייה נעשתה כאילו סלקציה, לקחו את כל האנשים, ואמא שמעה. נפרדנו מהמשפחה, לא ראינו יותר את המשפחה. נשארנו רק עם אמא, אני... בצד אחד, אני החזקתי את היד של אמא, בצד שני אחותי, ופתאום מישהו קרא צבילינגה, ואמא אמרה שיש פה תאומות. רצו להפריד בינינו ובין... בא איזה אסס שהוא ממש רצה לקחת אותנו, התחלנו לבכות, אז הוא אמר, טוב, שנשאר עם אמא. לקחו אותנו לצריף, איפה שכל אחד כאילו נהפכנו מאנשים למספרים. כל אחד קיבל מספר. למחרת לקחו אותנו למרפאה, ושם עשו לנו כל מיני בדיקות וזריקות. והשוואות בין חלקי גוף. בין אחד לשנייה. והכניסו אותנו לבלוק של התאומים. כמעט כל יום לקחו אותנו במנגל או איזה קצין אס-אס, ולקחו אותנו למרפאה, ושם המשיכו לעשות כל מיני ניסויים שנורא הכאיב לנו, והיה מאוד קשה, ולפעמים גם קיבלנו מכות, ומאוד מאוד פחדנו, וזה המשיך. למרות שפחדנו, כל הזמן באו ולקחו אותנו והפחד הכי גדול שלנו היה, שראינו שהרבה תאומות שלקחו, חזר רק אחד, לא חזרו שניכם, ואנחנו נורא פחדנו שלא יעשו לאחד מאיתנו משהו, שאנחנו לא נוכל לחזור ביחד. חוץ מהפחד והזוועה מה שעברנו שמה, שאנחנו לא רוצים להזכיר את זה. זה מאוד עזר לנו, עצם העובדה שיכולנו להחזיק ידיים וחיינו ביחד. אולי פיזית אנחנו לא רואים את כל הסבל והזוועה שמה שעברנו. אבל מצד שני, יש לנו אי ביטחון, הרדות ופחד מהרופאים. אף אחד לא יכול לתאר לעצמו את הפחד, מה שיש לי, לגשת לרופא. מאוד חשוב לי שאנחנו הולכים לרופא, שהרופא יחשוב על הפציינט. אחרי המחרה נמצא בן אדם עם נשמה, שמי יודע מה הוא סוחב כל החיים שלו. זה לא חשוב אם הוא היה בשואה או שלא היה בשואה. אף אחד לא יכול להבין את זה כמו שאנחנו מבינים את זה, כמה שחשוב להתחשב בתור בן אדם, לא רק בתור פציינט. ואני מקווה שאחרי כל הדברים האלה היפים, מה שרואים שהדוח הזה נותן ושעושה, אף פעם עוד לא יקרו דברים מה שאנחנו עברנו.
So, thank you for listening, and I promised David some Q&A time, so.
Thank you. One of the features of questions and answers is that they require people to listen to things, and as they listen to things, to have issues that are raised in their minds. I think that under the particular circumstances of this talk, I've got some questions that were raised beforehand and so on. But I feel that it's almost appropriate that we should end really with the thoughts of your grandmother and her sister, because I think that the one thing that is left out of that is that I feel that they can be very proud that there's somebody carrying on the traditions and recognizing the issues and working on the subject is an enormous legacy. So I think we should just leave it at that. And thank you very much, and wish you best of luck in your internship and in future career, and hope that you will continue to contribute ethically as well as in the clinical sense and in the educational sense, which are parts of being a doctor. So thank you very much.
Thank you for having me, and thank you everyone in the audience. Thank you for being here today and for listening.